When encaging a cat, the first step is to clean, sanitize, and return bedding or food and water. Be sure to sanitize every area of the cage, including the ceiling, in between the bars, the outside of the cage, and the name card holder. The name card should be completely filled out, including name, date in, date out, description of pet, weight, procedure information, and any other important information such as shy, go slow, will bite, blind, etc. Once the cage is set up appropriately, then you may place the animal in the back corner of the cage, preferably facing the front of the cage and on its feet. Open the cage door completely to minimize injury. Always keep a hand on the patient. When the cage door is open, slip the leash off, shut the door completely, and check that it is latched. When removing a non-aggressive cat from a cage, if there are any doors open that a patient can escape from, close them. Prepare any items like leashes or carriers before opening the cage. Coax the pet to the front of the cage, watch for attitude changes, open the door enough to slip a hand in. Hold the patient close to you with support of the thorax in your hand and the hind end on your hip. For removing an aggressive cat from a cage, use the same steps as before, but use protective equipment such as muzzles, towels, cat gloves, etc. Be sure to have a secure hold on the animal due to a heightened sense of fear or aggression. Be sure that if you're using a towel to cover the head completely, and make sure that you support the thorax and hind end. When transporting a cat to an exam room, ensure the pathway is clear of traffic, dry, and unobstructed. Follow the same steps about removing a cat from a cage. Carry the cat securely by placing a hand under the thorax with the fingers in between the front legs with appropriate pressure. Place a hand either under the chin to control the head or grasp the scruff of the animal. Walk with a steady pace and securely close the exam doors after. You may also use a cat carrier if possible. When restraining for a normal physical, put the cat in sternal recumbency with you positioned behind. Sometimes less restraint is more. When you are doing an exam for eyes and ears, have the patient in sternal recumbency with you positioned behind to have access to the head for control. When applying a nylon muzzle, select the appropriate size muzzle to allow breathing but no ability to bite. Place the muzzle on swiftly and clasp behind the ears. Be sure the muzzle is tightened behind the head. Check to be sure that you can see the cat's nose to ensure breathing ability. When applying Elizabethan collar, be sure to select the appropriate size to ensure that the patient can't reach its mouth to any part of the body, and tight enough that the collar cannot be slipped off. Be sure to be aware where the ears are. A patient may need an Elizabethan collar to prevent chewing or licking at themselves when certain procedures are done, including stitching, catheter placement, and etc. When wrapping a cat in a kitty burrito, place the cat in a sternal recumbency position on the towel with the head off of the edge of the towel. Next, wrap the cat as demonstrated to have control over the body, head, and feet. For restraint of a feline patient for jugular venipuncture, have the cat sit or be in a sternal recumbency with you behind or to the side. Drape the front legs over a table edge to allow access to the jugular. Hold any collars or leashes above the site for venipuncture. Hold the head tilted upward but not hyperextended. Once venipuncture is complete, hold the site to stop bleeding for an upward of 30 seconds or more. To restrain for cephalic venipuncture, have the patient sit with you behind or in a sternal recumbency. Position your hand caudally to the elbow of the front leg. Extend the elbow and front leg, creating a tourniquet with your pointer finger. Hold the compression until the venipuncture is complete, and hold pressure over site for an upwards of 30 seconds or more. To perform the lateral stretch, put one hand on the scruff to lift, while the other hand controls the back legs and adds support, while rotating on the side. With the hand holding the scruff, place your whole arm along the spine and stretch the cat to remove resistance. For feline femoral venipuncture, follow the same steps for the lateral stretch. Place the edge of the flattened hand deep into the animal's groin at the most ventral leg, using your fifth finger to create a tourniquet. Use the rest of your hand to keep the patient's other leg flexed and out of the way. Once venipuncture is through, hold off for an upwards of 30 seconds to ensure bleeding has stopped. For assessment of femoral pulse, place fingertips along the medial aspect of the animal's thigh, directly caudal to the hip joint midway towards the knee. Once locating pulse in both hind legs, auscultate the heart and compare pulse. The rate on this cat was strong and synchronized. The heart rate and pulse rate was 165 beats per minute. To obtain pulse rate or heartbeat, count for 15 seconds, then multiply by 4. Record this in patient file. To obtain the pulse of a cat without the femoral pulse, auscultate the heart, count heartbeats for 15 seconds, then multiply by 4. Record this in the patient file. When obtaining respiratory rate, allow the animal to be comfortable. Watch the breath to be sure the animal is inspiring and expiring completely. With a watch, count respiratory cycles using 15 seconds to count, then multiply by 4 and record in patient file. The rate for this cat was 38. In addition to visually watching for respiratory cycles, you may also feel for respiratory cycles. Capillary refill time, assess patient's temperament to ensure safety with dealing with the mouth. Slightly lift the lip on either side, revealing the gums. Depress the gums until white with moderate pressure from one finger. Release pressure and count seconds to return to normal. This patient was pink with a CRT of 1 second. Record this in the patient's record. This is also an excellent time to determine hydration status by determining moisture of gums. In order to determine hydration status, you can feel the gums, look at the eye's mucosal membranes, and do a skin pinch test. Record the patient's gum hydration status since it was determined with the CRT. This patient was moist. Also pinch in between the shoulder blades and lift the skin into a tint. The skin returned to normal on this patient within a second, therefore it was determined to have a dehydration percentage of less than 5%. To obtain temperature of a cat, be sure you have all necessary supplies first. Open the thermometer from its sanitized container, apply a water-soluble lubricant, lift the tail completely, and gently insert the thermometer far enough to get an accurate reading or cover the probe. Once finished, clean the thermometer and return it to its specified place and record in the patient file. The temperature of this cat was 101.2. For confirming gender, observe the temperament of the animal before approaching. Stroke from the head along the spine to the hind end. Firmly grasp the tail to expose the anus and genitalia. Observe their shape and determine anogenital distance. Next, palpate caudoventral abdominal wall for prepuce and scrotum for testicles. Record findings as sigmoid and compare results. This cat is male. For a microchip scan, test the microchip scanner for proper functioning. Approach the animal cautiously. Use one hand to turn on and operate the scanner. Scan entire body for microchip. Listen for an audible beep or alarm notifying for the microchip. Record the microchip number in the patient file if the patient has one. This patient does not. For a subcutaneous injection, be sure to have the correct patient, file, correct dose, and drug. Have the animal properly restrained. Select the proper site for administration. Create a tent in a skin fold. Insert the needle into the base and parallel to the long axis of the fold. Retract the syringe and check needle hub for blood or air. If blood is noted, change needle hub and start over in another location. Administer injection, check for bleeding or leakage, and record in the chart. To administer a liquid medication, pull out the patient's lower lip if possible without being bitten. Insert the syringe in between the cheek and gums. Give medication slowly so the animal can swallow. Allow the animal to rest if it struggles or coughs. For cleaning and medicating ears, select the correct patient file, select the correct cleaning product or medication. Have someone properly restrain the patient, remove hair from the external ear canal with hemostatic forceps if required. Next, administer Collini solution without inserting the tip into the ear canal. Massage the ear canal externally. Use cotton balls or cotton applicator sticks to remove debris. Once clean, the ears can be medicated in the same fashion without the removal of the medication. To administer a topical medication, be sure to have the correct patient, file, drug, and dose. Prepare the area before interacting with the patient. Be sure the patient's skin is clean and dry. If not, clean the area and dry the area. If the area needs to be clipped, then that should be done now. If applying a medication with your fingers, be sure to use gloves. Apply the medication the way the manufacturers intend. Be sure to wash your hands after. Record patient treatment and patient file. To clip the nails of a cat, select the appropriate style and size of nail trimmers for patient. Have an assistant help if necessary. Apply light pressure to the foot pad to invert the nail. Place trimmers in the appropriate position, being aware of the quick. If bleeding occurs, apply pressure or a cauterizing agent.